many people want to find a nursing home bed and can't find one, and they're eligible, and so they go wherever they go, and they don't incur the cost of the nursing home bed. Many people want an elderly waiver bed. They're eligible and they're in dire need, but there's not one available for all kinds of reasons. We've been through those discussions before. Many people want to get a ride to the doctor with NEMT, and there's, I don't know the number, but it's tens of thousands of people can't get rides to those based on state policy. And group homes, and we'll discuss this more in the budget when actually I just thought of those, and those are all things that have been reduced in the governor's budget, and I'm not sure if you know what harm he's causing, but do you guys keep track of what people that are entitled to get care that need it, that we've all agreed on are eligible, who could not access because of inavailability of those services or finding providers to do it? Do you keep track of that at all?
Ms. Bailey?
Cherokee Senator Abeler, that's a great question. In some cases, we do know, for example, with disability waivers where we have, the county authorizing services, so we know how much they're authorizing, and we know how much we're paying, how many units are billed. In those cases, we know the gap between those two things, and sometimes it's a result of somebody not being able to find a provider or find services that meet their needs. Sometimes it's other things like, the units were over-authorized or something like that. So we can't really find out in the data the reasons why there's a gap. In other instances where there isn't a service authorization, for example, all of our basic care programs or even nursing facilities, we don't know the counterfactual, right? We don't know what doesn't show up in our system in claims. So that's a challenging question to ask or to answer, I guess, on if our system were absolutely perfect and we could always serve people at the level that they need it, what would it look like? Yeah, because you're right. We budget on a cash basis, so how much we're actually spending.
And Mr. Chair.
Senator Abeler.
And so I'm not going to belabor it, but when the budget comes, I will belabor it. But I'm just going to give you a heads up on a question I'm going to ask. On each of those 4 areas, nursing homes, elderly waiver, NEMT, and group homes, I'm going to ask you for your modeling to support that your budget actually will keep those programs intact and provide the services they need. I'm particularly concerned about the NEMT where we've fought this before and it's going to collapse. The system's collapsing. These 4 areas are not serving the people that they're intended to serve. And I'm afraid the proposal that's been brought forward is going to do that more harmful. But I know in the department there's a lot of well-minded people or well-intended people. So I would like you to persuade me how it's all going to be fine if we do what the governor said. So that's my question ahead. But thank you very much. And I know the intention of everybody in this room who's connected to DHS, and they intend exactly what I'm saying, that people will get served. So thank you very much.